Welcome everyone to the Monroe County Council work session. It's 5:31 p.m. on Tuesday, July 28th. We are called to order. If council members present could make sure that their mics are unmuted. We're going to do a quick roll call vote just to see who all is present here before we get started with our meeting. So we'll just call the roll here real quick. Councilmember Deckard. Don't see Mr. Deckard. Councilmember Hawk.
Present.
Councilmember Iverson.
Present.
Councilmember McKim.
Here.
Councilmember Munson.
Here.
Councilmember Wilkes.
Here.
Okay, so we do have a quorum present. We'll move forward with the next items on our agenda. And up first, we have departmental updates. Do we have any departments who would like to provide an update? We'll do about 5 minutes each for any department who would like to provide an update.
Is Julie talking? Yes.
I believe we have Commissioner Thomas with us. Hello, Commissioner. Thanks for joining us.
Hey, how are you today?
Doing great.
Hey, everybody. Good. I just have a couple quick updates for you. First, we invite local businesses and not-for-profit social services in Monroe County to go ahead and apply for some CARES funding. We are accepting applications via the web, so just go to co.monroe.in.us. This would be for expenses that have not yet been reimbursed, but expenses related specifically to COVID, non-personnel expenses. So it could be things like PPE, mask, gloves, plexiglass, those kinds of things that have not yet been reimbursed that we can help with. So we're happy to offer that to every business and every not-for-profit in the community. Also wanted to give you a quick update that we are negotiating with on some training to improve the quality of place for Monroe County government employees. This would be a 2-year professional development package to deal with self-awareness, working with cultural competencies, and working toward a cultural shift, de-escalation, bystander interventions, confronting bias, and working on communication skills to overcome all biases. So it's a comprehensive program. We're really proud to be working on this. We are also in the process of negotiating a leadership component for policymakers. So we will definitely keep you posted on that as we go along. So I just want to give you that update today.
Very good. Thank you, Commissioner Thomas. And do we have any questions for Ms. Thomas?
One.
Yes, Ms. Hawk, please.
Yes, I just wondered if we had checked at the state level to see what might be available for training there that they already have in place. They do such a good job of keeping us updated, the whole Association of Indiana Counties. I'd be surprised they didn't already have something in place. Mike.
Okay, thank you.
I'd like for you to check it.
Okay. Any other questions or comments? Okay, and just for the record as well, Mr. Deckard has joined us, so we've got everyone here present with us tonight. Do we have any further updates from departments at this time? Okay, seeing none, we will move on to the next item in our agenda, and we have a presentation from HealthNet, formerly Volunteers in Medicine, and this is their annual update. Ms. Nancy Richmond is with us. Hello, Ms. Richmond. Thank you for joining us.
Thank you. Good evening. Can you hear me?
Yes.
Great. Good. Thank you. Well, it's always a pleasure to speak before you, even via Zoom, every year. And this year, for the first time, I'm speaking to you as an employee of HealthNet, which is fantastic. Almost 7 months ago, almost to the day, Volunteers in Medicine was acquired by HealthNet. And I spoke with you last year about our plans to do that and why we were doing that. And I can't tell you enough how thrilled I am about how this has worked out. It's really exactly what we hoped would happen with this acquisition and this partnership, with some challenges we didn't anticipate. So we were acquired the end of December. We opened early January as the HealthNet Bloomington Health Center. We immediately started a significant facility renovation. So we were all squished into the front half of the building while the back half was done. And then a month later, or 2 months later, we moved into the back half of the building while the front half was done. While all that was happening, we were recruiting staff and providers. And then while all of those things were happening, all of a sudden we were in the midst of a pandemic. So this was, the startup first 6 months was not the way we had anticipated, but it's been amazing nonetheless. So when I say we're doing exactly what we had planned to do, and what I mean by that is we had hoped to expand the scope of the VIM. Well, the mission's essentially the same, but we had planned to expand the scope of our services, and we have done that. So while VIM could only see uninsured people, even after 6 months, our utilization data showed that, actually 5 months, January through May, 42%, excuse me, of our clinic patients have some form of insurance. So that's amazing. That means that we're reaching low-income families with Healthy Indiana Plan. We're reaching seniors with Medicare. We're reaching people with commercial insurance that perhaps were on a waiting list someplace else. We had expected to take much more time before we went from our typical VIM patient, uninsured patient, to an insured population, but that happened almost immediately. The beginning of June, we started seeing kids with the addition of 2 new nurse practitioners. And one of those is only working right now a day a week. She's doing women's health. She's actually a midwife and specializes in women's health. So we're now seeing kids. We have women's health. And 3 weeks ago, our dental clinic reopened. So that's also fantastic. And because of COVID, all dental clinics were closed, all over the country and locally. And so we opened with the recommendations of the American Dental Association, like everybody else, and CDC, and with a grant from the Monroe County United Way, we have the specialized PPE that the dentists need, because that's a high-risk service because of all the spit involved, essentially. That's the professional term, I'm sure. And so we have the equipment and the PPE for the dentists. We are seeing people who are insured who are experiencing homelessness, because that was one of the demographics that we really felt was falling through the cracks, because, again, VIM was there to see people who were uninsured, and people experiencing homelessness are insured because their case managers help them get insured. And everybody who is a US citizen is eligible for insurance, regardless of home status or income and so forth. So that has been a real success story for us as well. There was a report in your packet, so you have a more detailed summary of what we've done in the last 6 months. But just a note on our finances. So while HealthNet receives some federal dollars, as a nonprofit healthcare organization, we still need public support. I write a lot of grants still, and like other nonprofits, HealthNet has been really challenged by COVID and the drop off of patients and revenue. I've been impressed with how HealthNet has responded to the COVID crisis, but it was difficult that some staff were furloughed. Staff in Bloomington and across the clinic, across the system, were divided into cohorts in order to try, we're a small clinic, and if one staff member tested positive, it would essentially close the clinic down if we were working as a group of 12. And so with other clinics, they divided the clinics into cohorts and each worked half a week, which meant people's incomes were cut by 50%. So, and now we're back to full staffing, full hours, and so forth, which is fantastic. But it's been really challenging. Our revenue has been down, staff salaries have been down. People have, some people were furloughed over the summer. Nobody lost their job permanently, but it has really been a challenge. And although, as you know, last year we did get the new access point from the federal government, that really was used to pay for provider salaries and the renovation funds and so forth. So I have spoken with the commissioners, and we certainly have proposed to continue to be in the commissioners' budget at the same level for next year. And I hope that will happen. And if that happens, I hope you will continue to support that, because we are continuing to do life-saving work, and to more people, all ages, all counties, all income levels. So any of us could go there as well for healthcare. And it's really, it continues to be an amazing team of compassionate people dedicated to serving people who are falling through the cracks. And it's been amazing. And I want to thank you all for the continued support of the council. And to not take up a lot of your time, I will leave it there and open it up to questions if anybody has any questions.
Thank you, Ms. Richmond, for the presentation. We will open it up to council members now for any questions or comments that you all may have. Who would like to go first? I saw Mr. McKim's hand, and then Mr. Iverson.
Thank you, Ms. Richmond. That was a terrific presentation. It's really exciting to see how quickly you've brought HealthNet along here and birthed a new organization, a new important part of our community. And so I think I heard the answer to this, but I just wanted to make sure that the support of local government is still important to you and to the organization and to serving your clients.
Yes, you did hear that. It's critical. It's more than important. It really is, it's critical. At this point, we are, as a new clinic, we are not where we had expected to be financially at this point in time. And some of that was the startup, and the rest of that is COVID, and that we couldn't have expected that. So we are significantly in the red. So HealthNet is supporting that, but we really need to get out of that situation. And yes, so government support is essential. I continue to write grants. I'm doing fundraising as I did at VIM. None of that has changed.
All right, and I certainly look forward to supporting you in this year's budget. Do you still? I know in the past you got some limited support through VIM from other counties, and do any other counties, or does the city participate at all? Just out of curiosity.
The city participates through Jack Hopkins, and that funded a large part of our dental expansion. Right now, other counties do not, partly because of COVID. I've spoken twice to groups in Brown County. When we have data to support that people from other counties are coming to the clinic, then I absolutely will be out knocking on doors and requesting support from other county councils, absolutely. But right now, it's just been, we don't have those numbers yet. It's just been too soon. And then with COVID, people aren't traveling for, for healthcare. People aren't leaving. And just to throw it out there, just so you know, we do have a grant from the Bloomington Health Foundation for transportation assistance. So I'm making that known as well to all of the contiguous counties, so that people know if they would like to come to us and can't get there, we have gas cards and bus passes and a contract with, it's either Lyft or Uber, I can't remember. And so we can pay for them to do that.
That's excellent. And I also think the Bloomington Health Foundation is underappreciated and underknown in this community. So that's great to hear that they're so supportive. So thank you.
Absolutely, yes, thank you.
Mr. Iverson.
Yes, Ms. Richmond, thank you for being here. First of all, I wanted to thank you for the report that you submitted. I especially appreciated the anecdote about Dr. Sutliff. I don't know if I'm saying his name correctly, but that certainly helped to emphasize your mission in action. So I'm glad you included that. That was nice to see. My questions revolve around something that you had mentioned is that you do a lot to help people who are slipping through the cracks. And right now, this council and everyone else across the United States is trying to get their heads wrapped around what exactly impact of COVID has been on our communities. And one of the things that I wanted to ask you is that unemployment is still historically high due to COVID-19 here in Monroe County. It's getting better, but it's still historically high. Are you seeing that as having any type of impact upon your operations?
You know, it's hard to separate out the impact of unemployment, loss of insurance, or just people's hesitance in coming to a clinic. We've certainly seen a drop off in patients. We know that the Latino community is suffering, that they were uninsured to begin with, and then they were uninsured and unemployed. We now know that some people are starting to test positive. So that has been a hugely hard hit community. We are seeing those people. I don't have to the minute data on whether say, in the last 2 months, the insurance status has changed of people who are now coming to the clinic or not. I know, I mean, I don't think I have more information than you do about how hard the community has been hit. And it's just hard to tease out which are the issues that are preventing people from coming.
Of course.
I hope it's not insurance, because we do have a sliding scale. And just to share with you that the VIM Board of Directors, in dissolving, did make a gift to the HealthNet Foundation, as well as the Monroe County Foundation, in order to set up a financial assistance fund for Bloomington HealthNet patients. Because, you know, while Volunteers in Medicine was free, HealthNet is not. And HealthNet has a very reasonable sliding scale. However, when we have to refer people to an outside specialist, or for radiology or procedure or mammogram even, we can't control those fees. And so this way, the VIM board ensures that the VIM mission of making sure that no one is turned away for lack of ability to pay, even for outside services, is safe. So we're just trying to get that word out as well, that if people are hesitant to come because they're uninsured, they're unemployed, and they have no money, we still want to see them, and we will make it possible for them to come and to have external services as well as on-site services.
I think that's really important this time. You know, as you know, federal unemployment protections are starting to slide a little bit, and the compensation that's being given to those who are unemployed was able to be lapsed, and so now, like, people are not getting the funds that they were getting for unemployment. So I'm glad that your services are there. I'm glad to hear there's financial aid, and I'm glad to hear that you're doing what you can with the resources that you have.
Thank you. And just to remind people that if one is an immigrant and undocumented, one isn't getting unemployment.
That's
so
wonderful.
Those services are available for U.S. citizens, low-income U.S. citizens who are employed, but not a lot of the immigrant population.
Healthcare is a human right.
Indeed.
Yeah.
Indeed.
Thank you.
Thank you.
Great. Any further questions from council? Mr. Deckard?
Thank you very much. And Dr. Richmond, it's good to have you with us as always. It's hard to believe that it's been a year since we.
I totally agree.
My heavens, a lot's happened. I'll be really quick because I don't want to take a lot of your time. You're doing important work. But I'm going to ask one of those council questions that for the public watching, or the public that might ever look at this in archives, I think will be helpful. You go into an emergency room, which you are not an emergency room, but you go into an emergency room, there's not a dental portion. please, I know the answer to this, but for the folks watching, why is the dental component of what HealthNet does and VIM before it, why is that so absolutely important that we support that and do that in the community?
Great, thank you for the question. One really can't separate out medical health from oral health. They are attached, they are joined at the hip, they are joined at the teeth. We recently had somebody, in terms of anecdotes, the second day we were open as our dental clinic, we had a gentleman come in with an intense pain with a raging infection in his mouth. The dentist did 5 extractions as an emergency, sent him to the ED because his infection was so severe, he was afraid it would travel to his lungs, and he wanted him to have IV antibiotics. They're just totally intertwined. Dental is also sometimes the first identification of risk factors for medical issues. Diabetes can be not triggered, but a dentist can pick up risk factors for diabetes and cardiac issues and so many other issues. Sometimes a dentist is the first person who picks up those issues. An underserved population has to have dental care. Kids are out of school more for dental care, dental issues than any other issues. You know, with cavities and so forth, kids in the school, they're in pain. Adults as well. It's not being very articulate here, but it's absolutely essential. You just can't separate out oral health from medical health. It's part of the whole person, and they're just too intertwined to not have one.
Thank you very much.
Great. Any further questions or comments for Ms. Richmond? Okay, seeing none, we will let you get back to your evening. Ms. Richmond, thank you so much for the presentation, and thank you so much for all the great work that you're doing for our community. Really appreciate it.
Thank you for the opportunity, and it's great to see you all. I hope you are all well. So, thank you.
Take care. Okay, and now we will move on to our next item on the agenda. And this is the recommendation from the Sophia Travis Community Service Grants Committee. Council members Munson and Wiltz and myself served on this committee along with 2 citizen members, Rachel Guglielmo and Ryan Boyce. Councilor Munson, would you be able to give us an update on this year's grants, please?
Yes, I'm very glad to. And I want to thank all the committee members for their hard work on this. This committee, I like to say, is one of the most challenging assignments in county government, but also among the most gratifying. Committee members read and reviewed 33 applications from not-for-profit organizations. They submitted $233,566. Excuse me, my dogs. Take care of my dogs, Pat. In grant requests for financial help, with financial help for projects that total nearly $3,630,000. A broad range of community services, health, food, nutrition, security and shelter, youth enrichment opportunities, transportation assistance, climate change, emergency shortages, first responders, veterans assistance, and excellence in government, all were eligible for awards. Our available funding for 2020 for Sophia Travis grants was budgeted at $130,000, significantly less than our request. And we recommended awarding every penny of this amount because we know the funds are going to good works for our community and they're covering a wide range of needs. The committee will make its recommendations to the full council, which will then make its decision on the awards. And Ms. Guglielmo and Mr. Boyce, are you ready to present the committee's recommendations? Are they?
Yes.
Great. Please begin. Thank you.
So, Ryan, shall I start?
Go for it. Yeah.
Okay. I'd just like to say briefly that it has been simultaneously extremely invigorating and energizing and very humbling to work for this committee and to see the range and the depth of actions and activities that are undertaken in our community. So it's been a real pleasure to serve on this committee. So we'll read out the grants one by one, the name of the agency, the use of the award, and the amount of the award. The first is Alexandra's Food Drive, which will be used to create a children's nonprofit. And the award is for $1,400.
Next, we have the award for the All Options Pregnancy Resource Center. The use of the award is their diaper program, and the award is $4,060.
The next is Amethyst House Incorporated, to be used for residential food program. The award in the total of $4,010.
Next is the Amethyst, the Big Brothers Big Sisters of South Central Indiana. The use of the award is for their Bigs with Badges program to be continued, and the award amount is $5,110.
Next is the Bloomington Refugee Support Network, to be used for supporting Bloomington refugees in Bloomington. The amount is $2,800.
Next is the Bloomington St. Vincent de Paul. The use of the award is for truck maintenance and repair fund in the amount of $4,560.
Boys and Girls Club of Bloomington for youth summer programming, $4,050.
Catholic Charities of Bloomington Incorporated for the parent coaching program, $2,080.
Community Justice and Mediation Center, CJAM, to be used for supplies and scholarships, $2,640.
To the Community Kitchen of Monroe County Incorporated for food purchasing, the award is $4,600.
Courage to Change Sober Living for starter house kits, $2,950.
For Grace Center Incorporated, food purchase, the award is $2,300.
For Habitat for Humanity of Monroe County for site preparation, $4,500.
For Hoosiers Feeding the Hungry, the Meet the Need program, $4,000.
For Hotels for Homeless, sponsored by New Leaf, New Life Incorporated, for a technology upgrade, $2,500.
For the Indiana Recovery Alliance, education and naloxone, $4,800.
For the Lotus Education and Arts Foundation, for their puzzle project, $1,830.
For the Middle Way House Incorporated, childcare, $4,880.
For Midway Music Speaks, for their education initiative, $2,400.
For the Monroe County Health Department, disposal, $3,490.
Monroe County United Ministries Self-Sufficiency Program, $4,160.
For My Sister's Closet of Monroe County, for the job training and education, $2,950.
For New Hope for Families, for their Responding with Equity program, $6,880.
For the New Leaf, New Life Incorporated, support materials, $4,610.
For Pantry 279, for their mobile outreach program, $5,700.
For Planned Parenthood of Indiana and Kentucky, financial assistance, $5,900.
For Safe Families for Children Alliance, for the Safe Family Care for Children program, $4,850.
For the Shalom Community Center, upgrade and renovation, $6,385.
For Sojourn House, renovation, furnishing, and equipment, $3,585.
For Stepping Stones, Centerstone of Indiana, the Youth Support Fund, $5,450.
For Team First Book, for libraries for low income, it's $2,250.
And for the warehouse, the mobile warehouse, $4,120.
And for Wheeler Mission, for operating support, $4,200.
So thank you, Rachel and Ryan. That's very nice summary of our deliberations. But I want to ask, did Centerstone perhaps get left off your list?
I read off Stepping Stones of Centerstone.
That's
of
what
Indiana.
it is.
Yeah, I believe those combined into one.
It was combined into, not listed as Centerstone, but as Stepping Stones.
That's right.
Good, thank you.
So Council, I would like to make a motion to approve Resolution 2020-36, the award of Sophia Travis Community Service Grants, which reads, now therefore be it resolved that the Monroe County Council's total distribution of the Sophia Travis Community Service Grants Fund for 2020, as read by Rachel Guglielmo and Ryan Boyce, for a total distribution of $130,000 to the community organizations listed.
Second.
Okay, we have a motion and a second. Are there any questions or comments on Ms. Wiltz's motion?
Can you hear me?
Yes, Councilmember Hawk.
I would like to ask for a separation of the question so that I'll be able to support most of what the committee has decided. But I would like to remove from the question two, the one for Planned Parenthood and the one for all options, and then have separate votes on those.
Okay. Ms. Shell, could you let us know what the bottom line would be minus Planned Parenthood and all options?
Yes, but I do need a motion on her request, or a second on her request.
Second.
I didn't put it on it.
Oh, okay.
I mean, that's fine, but I didn't really put it in the form of a motion.
I'm fine to accommodate the request. If others want to make a motion, that's fine as well too. But
Okay, so if we were removing all options as well as Planned Parenthood, the first motion would be for $120,040.
okay.
Planned Parenthood and all options total is $9,960.
Okay. And Ms. Hawk's question is noted. I'm fine to accommodate that request. So we will consider first the total grant dollars of $120,040, which would actually, no, I guess the way that we would do this is we will do that after the public comment portion.
Correct.
Okay. Okay. Any other questions or comments from council?
Is this the time for just general questions from council? And this one may be one that folks can't answer, and I can just do my homework later. Do you happen to know who were new awardee recommendations this year from last year? And if you don't know, that's fine as well. I can do my own homework on that. I'm just very curious.
I know of two for sure. Alexandra's food drive was a new one, and then also Hotel for Homeless,
Yes.
I believe, and then there may be others.
Thank you very much.
I think Sojourn House is a new
And so,
one.
yep, Sojourn House.
Didn't have that read off. Could you explain what Sojourn House is?
Yes, Sojourn House is a shelter for women and children that is just being developed in Steinsville at the elementary school there.
Okay.
And so their request for furnishings and renovation and equipment is so they can just get started.
I remember reading about it, but I wasn't connecting the two. Thank you.
Okay. So I would note one other point on this, and that is that Wheeler Mission was no longer able to support a shelter for women and children. So this was an important addition to our community services.
Thank you, Ms. Munson. Any other questions or comments from council on the motion? Okay, so now we'll move into the public comment portion. So although we're going to have two votes that we'll take, we're going to divide this up into two separate votes. We will do public comment on the entire dollar amount and all organizations subject to receiving these dollars. So the way we'll do this is I understand that there may be some folks on this call tonight who'd like to make public comment that have multiple people with them that would like to make comment, kind of pass the microphone to the next person. That's totally fine, no problem with that. But please just let us know at the very outset with the first speaker, how many speakers you plan to have, how many different speakers you plan to have making comment. And we're going to limit the time period for each speaker to 2 minutes. So just let us know how many speakers you have who would like to speak, and they'll each have 2 minutes for comment. If you wish to make comment on this motion, please use the raised hand function in the participant list located at the bottom of the Zoom window. Again, please state how many speakers will be making comments before beginning the initial comment. Each speaker needs to state their name for the record. And as I mentioned, you'll have 2 minutes for your individual comments. Once the 2 minutes are completed, the microphone will automatically be muted and the next speaker will then have 2 minutes and so on and so forth. At the end of the last speaker, your time will be completed for that particular caller, and our technology services department will move on to the next person who has indicated they want to make comments. So hopefully that makes sense. And now we'll get into the public comment portion. So go ahead and start raising hands. I see one.
May I ask TSD to sound the 30-second tone that they need to be listening for?
Yes, give me just
Yes.
one moment.
Yeah,
please.
that would be great.
Thank you.
Everyone able to hear that?
Yeah, very good.
Lovely.
And And just as a reminder for everybody, public comment on the Sophia Travis Community Services grants is for this agenda item only. This is the only agenda item we're taking public comment for this evening. And it needs to be related to this agenda item.
All right, first up is Jana Arthur.
Hi there. Can you guys hear me? Okay. Yeah, I just wanted to mention that Planned Parenthood provides a lot of gynecological services to folks in the community, and All Options diaper program is very important for folks, especially with the pandemic. I think it's important that you all choose to fund both of those, even though it's being voted on separately, and I yield my time.
Thank you. Next speaker.
There was one hand raised earlier, but it looks like they lowered it, so there are no hands raised currently.
Okay. So we'll do one last check. Is there any additional public comment on this agenda item?
There is.
Okay.
Next up is Lydia.
Hi, Lydia. Could you get your name for the record? Full name?
Yes, Lydia Campbell-Mayer. I also want to ask the committee to fund Planned Parenthood for their important services that they provide to women, men, and women and men in our community. Thank you. I'm done.
Thank you for your comments. Looks like Mr. Goodlad had a comment.
Can you hear me?
Sure.
Okay, great. So I sent a kind of funny email being like, hey, that's a waste of time, Marty Hack, about the Planned Parenthood funding. But actually, I think separating items is good. I changed my mind. But that being said, I do think that we should reconsider, what's so bad about Planned Parenthood. Like, I think that, with birth control, I think that actually reduces, the problems that, from what I understand, the right has. So that's all. I yield my time.
Thank you, sir. Any further comments?
There do not appear to be any hands raised.
Okay, thank you. And seeing none, that will conclude the public comment portion. Are there any further council comments or questions at this point? And I see Mr. McKim saying first, and then Ms. Hawk.
I just wanted to thank the members of this committee, the council members, and in particular 2 members of the public. We always appreciate this kind of intense level of participation from the public in making important decisions for the community. And so I really appreciate all of your efforts on this. This is one of the many important things that the county council does in the year. And so yeah, your efforts and experience are very much appreciated.
Thank you. Ms. Hawk?
Yes, I want to join in thanking you for serving on this committee. I've served on it, and it's a tough committee because there's just not enough money to do everything you would like to do. We have so many great organizations. This community is blessed with a lot of organizations that want to provide services. So I appreciate your service in doing that. I also wanted to follow up to say how fortunate we are here in Monroe County. Monroe County government has their own family planning clinic that is available, that is for the public. It's for not just our county. It provides family planning services as well as other services as far as that. And then on top of that, as you just heard, there's also women's health issues that's being covered under what was the VIM clinic. And so those portions are taken care of. I do believe that family planning is essential, and that's the reason why I pushed as well when it was first presented to us that we could have that. And we need to get that good news out because that's available. It's in the lower level of our health building, and they do a great job. And then when it comes to the diaper service and having diapers available, that's also available in this community. So that's something that is already there, and the Hannah Clinic helps with that. And so it would seem to me that these dollars, almost $10,000, might better be used in food services and other great organizations. And so once again, I'm very pleased that we have Futures Family Planning Clinic and the great job they do. So thank you so much.
Thank you. Mr. Deckard.
Thank you very much for allowing me to speak. I just want to make a couple of quick comments. One thing that I always marvel at in this community is for as big a community as we have, we're still incredibly small in that we have a lot of folks, but it's a very tight-knit community, a lot of moving parts. And these organizations and agencies that are represented on this list do some pretty amazing things in the community at reaching individuals and families that don't get reached by other things or often find themselves in need in the most. I'm always amazed in my council service. I do some things, my family, we do things with some of these entities, volunteer, attend fundraisers, help with fundraisers, all sorts of different things. I'm always amazed my council service doesn't intersect with that. And I like it because I get the best of both worlds. These entities that are represented reflect some of the small things that we can do where we've set aside these dollars to make an impact with these not-for-profits that are doing things that the government is not doing, that is not getting done in the private sector, and particularly in a pandemic, we get very cognizant on. I also want to thank All Options for inviting me out and I'll thank a lot of us out back when you could actually go to places along last year and talking to me about the diaper drive and talking to me about their clientele and the folks that are intersecting with them on a daily basis. There is so many great things happening here. We've got Sojourn out in Steinsville all the way to downtown Bloomington. There's just great things happening. And I want to thank Rachel and Ryan for serving on this. Horrible to have to choose in this, but this is a good example of a committee working on the behalf of the council that we're listening to the recommendations and adopting that. And I support that today. Thank you.
Thank you, sir. Councilmember Munson.
Yes, I wanted to say that in addition to public comment, council members like myself received emails about the Sophia Travis Grant Awards. And I would just like to clarify for people who are concerned about Planned Parenthood that the patient financial assistance is specifically for preventive healthcare services. This has to do with cancer screenings, STDs, urinary tract infections, all of which can have dire consequences if not taken care of. And this is not for other services which people were objecting to, which include abortion services. So I thought that was important to add to this commentary.
Thank you. Any further questions or comments from council? I'll just be real quick here and say thank you as well to Councilmember Munson for her leadership on this committee. She's been terrific as always. Thanks to Ryan and Rachel for your great work. I know this is tough work for me, serving on this committee. Great honor, but it's tough, and these are some really difficult decisions that we have to make given the limited resources that we have, and when there's so much need out there. But I'll reiterate what Councilmember Munson just said. This is healthcare, and healthcare is critically important right now, perhaps more than ever, as we're in the middle of a pandemic and people are really, really in need. So I just appreciate all of the work that everybody's put in. I appreciate all the public input. Also received the emails and reviewed all of those as well. So thanks to everyone who sent in their comments. And now I think we are ready to move on to our vote on the recommendation. And the way that we'll do this is we will separate this out into two votes. The first vote will be for all organizations with the exception of Planned Parenthood and All Options. And that total dollar amount is for $120,040. And that would be a motion that I just made.
Second.
Okay.
Counselor McKim,
Yes.
Counselor Spoonmore,
Yes.
Counselor Munson,
Yes.
Counselor Hawk,
Yes.
Counselor Iverson,
Yes.
Counselor Deckard,
Yes.
Counselor Wiltz.
Yes.
Motion passed unanimous.
Okay, and then in the second phase here will be the Planned Parenthood and All Options for a total dollar amount between the two of $9,960.
Also second.
Counselor Wiltz,
Yes.
Counselor Deckard,
Yes.
Counselor Iverson,
Yes.
Counselor Hawk,
No.
Counselor Munson,
Yes.
Counselor Spoonmore,
Yes.
Counselor McKim.
Yes.
Motion passed majority 6-1.
Great. Thank you all again for all of the work on that. We will move on to our next item on the agenda. And this is the Public Safety Local Income Tax Subcommittee recommendations for 2020 funding. Or is it 2021 funding?
Yes.
And I will now introduce Councilmember Munson. Councilmember Munson's got a busy night here with reports to our council tonight. So please, could you provide an update on our recent subcommittee meeting and the recommendations that were made?
Yes. First of all, I want to preface what I'm saying with a big thank you to the Herald Times for 2 articles which explained in great detail about the workings of the Public Safety Local Income Tax Committee and the process for our consideration of funding for what are called qualified service providers. Those are the rural fire departments that are not part of City of Bloomington fire services. And this was this job of deciding on how much funding is to be given to rural fire protection has been taking place since the Public Safety Local Income Tax was established and first used for funding in 2017. So this will be the 5th year of funding, and we're talking about funding for 2021. In each of the in each of the previous yearly considerations, there was approximately 4.5% in round numbers of the total funding of public safety local income tax revenue that was awarded for the qualified service providers, the various rural fire departments. Since 2017, these fire departments have consolidated into what is becoming one major rural fire department, and that's the Monroe County Fire Protection District. And so each year we've had fewer and fewer applications to consider as people have joined up with the district or actually joined together in other team efforts to provide rural fire protection. One year, there was no funding provided for the fire departments because all of the funding was all the funding proposed was handled by the consolidated dispatch center, the central dispatch center, and they developed a communications program to increase communication with the rural fire departments, and these were for radios and for laptops for recording information. And that was in 2018. So the way the funding works is that there is a reported amount of revenue communicated by the state of Indiana, first as an estimate of public safety lit revenue, and then later a final number. This year, there is a delay in the reporting of the first estimate. So we don't really have a very tight estimate of how much revenue is available. And this is challenging because the first funding is to be awarded to what is called the Public Safety Answering Point. That is the Central Dispatch Center. And after that, the available revenue may go to the qualified service providers, and then the remainder to each of the government units that are qualified. And those government units are the city of Bloomington, the county, the town of Ellisville, the town of Steinsville. And that is according to their certified shares based on a number of factors, including their budget. So not knowing where we're going to start from, I turned to my colleague, Jeff McKim, and said, Councilor McKim, what is the latest number that we can use as an estimate for public safety lit revenue? And Councilor McKim, would you please explain that?
Sure, and as I sort of punted on this one because as Councilor Munson mentioned,
well, I punted.
We don't actually have a real estimate. So what we used was what the state has provided us essentially as in my world we call it a bogey, but essentially a target number to work from, which is 90% of last year's revenue. In all likelihood, that's a conservative estimate. That would mean essentially, because remember that the revenue that comes in 2021 comes from incomes that were earned in 2019. So the actual incomes are not affected by COVID for 2021. This is money that's was already earned by taxpayers before the pandemic hit. The only question is that although the tax deadline was extended till July 15th, we still don't know if some taxpayers are simply going to be unable to file their taxes by July 15th. We have no way right now of knowing how many taxpayers will still file late even after that extension, will be unable to file. because they don't have the means, and we simply don't have that information yet. So the state recommends using 90% of the 2020 numbers, which accommodates a fair amount of unfiled tax. Like I said, I think that's probably going with the 90% number is a conservative estimate, but it's the best we have. And I think we're safest if we go with that, with what the state is providing at this point. So those are the numbers that when we entered into this meeting to make the recommendation, I went ahead and used the state's recommendation of 90%.
So that number is actually $7,789,211.
Oh, and I think Marty has a comment also.
Do you hear me
Right.
right now?
Mm-hmm. Yes.
Okay. I'm having some internet issues, and I can see
Oops.
everyone's frozen on my screen. I can hear. So we'll continue to do this the best we can. I can hear, but I can't. Everyone is frozen. So if anyone wants to speak, please speak up. I can't see you. Is that Marty?
Right.
Yes.
When you, Jeff McKim, when you use the 90%, was that the amount that was originally presented to us for this year, not the additionals like that?
Correct.
Yeah,
This does not include the supplemental distribution.
Right. Great. Just want to make that sure. And so that number then that is 9. What?
Do you want me to say it again? Sorry.
Yes, please.
It is 7,700,000. Okay, let me start again. 7,789,211.
Okay, and
That's
that
the estimate.
And that's for 1/4%. I mean, okay, and once again, that brings us. But we can discuss this later, but that's the reason why I don't understand why anybody's saying 4 million when people are talking about 1/4% of the a proposed new income tax is being discussed at the city level.
Right.
But that number, it really should reflect this number that you have, because that's more the correct number for the 1/4%.
Right.
Okay.
So
and then just
go ahead.
Oh, sorry. So just to finish up this discussion, remember that although we're using 90% of last year or of this year for next year, theoretically we might even get more. I mean, we could if the vast majority of taxpayers file on time, and the economy certainly did grow in 2019. We very well could actually receive more in 2020 or 2021 than we did in 2020. So we should expect that, and then of course we'll expect the dip in 2022, depending on how bad it continues to be with the pandemic economy.
Right. Okay. So the other parts of this consideration are that our local dispatch center, our public safety answering point, has a proposed budget approved by their policy committee of $2,247,490. And we just plugged in that number and considered an approximate number of 4.5% from the revenue estimate, the conservative revenue estimate. And that total amount was $353,700. And that would leave to be divided among the county, the city, and Ellettsville and Steinsville, a total of $5,188,022. And this is very comparable to amounts for previous years. All right. We wanted to consider each of the applications for funding from Public Safety Lit, and there were 4 applications submitted from Monroe Fire Protection District, Ellettsville Fire Department serving Richland Township, Bean Blossom Township and Steinsville Volunteer Fire Department together, and the Benton Township Volunteer Fire Department. They each requested different amounts, but almost all of them were for capital outlay. Only Bean Blossom considered personnel services in the amount of $30,000. Each of the fire departments also listed, as we requested, their priorities, and we asked them to identify their most urgent needs. And so we considered these, and to be brief about this, because we will talk about this again, the committee recommended amounts based on urgent needs, but also with a consideration for the size of the population in the areas being provided services. So Monroe Fire Protection District, which takes care of Clear Creek, Indian Creek, Salt Creek, Polk, Bloomington, and Van Buren townships outside the city limits, has a total estimated population of 38,070 individuals. Richland Township is 8,823. Bean Blossom Township in Steinsville, 3,384. In Benton Township, 3,148. So for for the requests by Monroe Fire Protection District, they asked for 215,000, and we are recommending 170,000 for fire station remodel and 1 mobile repeater. This is to enhance communications that are interrupted by the hills and hollows. For Richland Township, they asked for 20,000 for 1 mobile repeater, and we are recommending 1 mobile repeater for 20,000. For Bean Blossom Steinsville Volunteer Fire Department, they asked for an exhaust ventilation system in their fire station, 5 mobile repeaters, and part-time personnel for a total of $173,695. We are recommending funding for their exhaust system and 2 repeaters for a total amount of $83,700. Benton Township asked for mobile repeaters in the amount of $58,294, an interior exhaust system of $80,000, and renovation of the station at $195,562. And we recommended funding for their exhaust system in the amount of $80,000. The total of our recommended amounts are $363,700, which goes back to the 4.5 approximate percent that we considered in previous years. So that's a lot of numbers, but it all gets back to public safety, and this is fire protection and emergency service, medical services that come from our rural fire department.
Great.
Does anybody,
thank you, Councilor Munson.
Committee members, would you like to add anything to this?
Go ahead, Mr. McKim.
Oh, just wanted to add real quickly that I know you see a couple of requests here for exhaust systems, and members of the public may wonder why that's so important, why that's an urgent need. But there's been a lot of research lately that found that firefighters are particularly afflicted by cancer caused by the chemicals that they come in contact with in the line of duty. And I think we really owe it to our firefighters to do anything that we can to make sure that they are in a clean environment, and that the chemicals that they have to come in contact with, burning plastics and that sort of thing, that we give them all the protection we possibly can, from the best turnout gear, but also to keeping the stations, keeping the air quality in the stations as high as possible. So I'm definitely very much on board to support all these requests, but particularly the exhaust systems right away. I think that's it's a must-have.
Great. So now we'll turn to council for any questions or comments that they have on the recommended amounts. Who would like to start? Ms. Wiltz?
Yes, this is really just from the bottom of my heart, thank you to those of you who do that calculating and decision making, because as much as we talk about how Sophia Travis grants are so difficult to make determinations about, my goodness, this is a lot. And, you know, it's really, really important. So thank you, Councillor Munson and Councillor McKim, for your assistance to that as well. I really appreciate it.
So,
Mr. Iver, and then Ms. Munson, and then Mr. Deckard.
I think maybe I should yield to Councilmember Munson. I think she wanted to respond to Kate.
I did.
Sure. Okay.
I just want to explain that I am always willing to do this, because in my former life, I was president of the board of directors of a volunteer fire department, and served previously as secretary for many years and also vice president. So I have that experience of knowing firsthand about fire department needs.
It shows.
Mr. Iverson?
So I also want to thank the committee for these recommendations. It's really good to see Benton Township being taken care of here, as well as the broader areas. You know, in the first district where I represent, there's a lot of I think, as you said, Councilmember Munson, hills and hollows. There's a lot of ups and downs there, and I think anything we can do to make sure that we're taking care of our response times and making sure that we're getting people out there and we're keeping, like as the Councilmember Kim said, healthy. This is just fantastic, and I'm glad to be a part of this.
Mr. Deckard.
Thank you very much. I had a question and then just a general comment. And I had asked this prior of Cheryl Munson, but just for the public's sake watching, and you covered it, but I want it to be explicitly clear. The amount that the Ellettsville Fire Department's asking for on behalf of their service to Ellettsville and Richland Township, the most they asked for was the $20,000. That's not a decision of this body to go with a smaller amount in proportion to the others, correct?
Right. They asked for a relatively small amount. And I would emphasize that Ellettsville Fire Department is asking specifically for their services to Richland Township, because of course Ellettsville Fire Department serves the town of Ellettsville, and they will receive public safety lit funding as part of the certified shares divided up among the various government units.
Thank you. And just a comment, I'll join everybody else. I actually got to assist with this last year, serving on the subcommittee, and it's some of my happiest times serving the county. What these dollars do are impressive amounts in impressive places. If anyone in the public visits or has a chance to visit any of our stations all over this county, the wonderful things that they're doing and the knowledge base that they have and just the heroic nature that they have, it's awesome. And it really, I want to compliment Cheryl and Jeff, because I got to watch them in tandem working on Excel sheets, and it's some of the most impressive work I've ever seen. This does great things, and I know this is evolving as the nature of how fire coverage is dealt with, and as townships and other local entities are making decisions, this is evolving, but it's relieving for the public to know these resources are there. So thank you both, and Eric too.
Ms. Hawk?
First of all, I wanted to say a big thank you to the City Council, because one of the things that early on they were asking for was, and it seems it's coming to fruition, is that all these different fire departments join together and work together so that they didn't have all these split up fire departments. And that's really coming together, and a lot of it because the City Council had encouraged it as well. And so because of that, they allowed then that the County Council could begin this process. We have to make it very clear to the public, this is not final, this is part of the process, because the final decision will be made by the City Council since they have the controlling vote on the Income Tax Council. But they've pretty much in the past made it clear they wanted these different fire departments to work together. So I hope they continue to support that, because these fire departments are serving throughout the county, and the citizens who live in the city are going outside of the city to work and to recreate and so forth. And those fire departments and first responders are so important throughout the county for the residents that live in the city and outside. Thank you for serving. It's a tough job.
Mr. McKim?
Yeah, I guess I would like to just follow up real briefly on what Councilor Hawk just said, and also just say that the city and county don't always get along in many ways, but I'll tell you, it is a pleasure working with the Bloomington City Council. Both on this and on several of the other projects that we worked on together. I think they're a really good group of people to work with, and I really appreciate their willingness to have, even though they don't represent, almost by definition, they don't represent a single person in these unincorporated areas. They have really made a strong effort to understand the role that these township fire departments play, and to understand the relative roles of county government versus city government. And like I said, I just think they've just been really great to work with. So.
Okay, thank you. So this was actually my first experience with the Public Safety Local Income Tax Subcommittee. I very much appreciate all the
Oh no.
Oh, we lost him mid-sentence.
Is he gone for real? Okay.
Like it.
So he really appreciates everything.
Thank you, President Pro Tem.
Now I'm just gonna stutter and stumble until he can log back on. Are there any other comments? I think he was wrapping up, but did anyone else have something they wanted to say? If not, then we are to move to the next item on our agenda, which is still public safety, local income tax, but it's a resolution. The approval of resolution 2020-37. And since I make the motions, I'll just go ahead and do that. Council, I move to approve resolution 2020-37, Monroe County Council recommendations to the Monroe County Local Income Tax Council to provide public safety local income tax funding for township fire and volunteer departments and emergency medical service providers, which reads, now therefore be it resolved, the Monroe County Council recommends to the Monroe County Local Income Tax Council that a total distribution of $353,700 of public safety local income tax dollars be distributed to the following agencies as follows. Monroe Fire Protection District, $170,000. Ellettsville Fire Department, $20,000. Bean Blossom Township Steinsville Volunteer Fire Department Incorporated, $83,700. And Benton Township of Monroe County Volunteer Fire Department, $80,000.
Second.
So, Council, are there any comments or questions on this resolution? Councilor Iverson.
Let me offer some comments, and we'll see if Eric can come back on. One of the things that I had the absolute pleasure of doing before we were all in lockdown was being able to visit the fire station out in Benton Township. And they have really done a lot of work to make sure that a lot of their equipment is up to date. And, you know, they're a volunteer fire department. And it was really great to be able to just walk around and see just what exactly all goes into making sure that those folks can get out and just visit all over the different areas that they're required to go see. And I think Councilmember Deckard had said it, but until you get out there and you really walk around and see, you just really don't have a very good idea at all of everything that's done. And so that was really a delight to see. So I was really thankful to have that opportunity.
Yeah, I have to agree. Living in town, I was not familiar with the extent of services offered by these departments. And before I ran for office and started looking into it and visiting with folks. If you haven't checked out your county volunteer fire departments and the fire protection districts services, you definitely should. Anyone else? Comments? Darn it. I suppose we should then do a vote.
No, public comment.
Public comment. Okay. Are there any public comments? Which I can't see. Hold on.
There's one hand raised. Give me 1 second to get the timer back up.
Thanks.
All right. First up is Alex Goodlett.
Hi, Alex.
Hello, Kate, and hello, everyone else. You know, I looked at that item, you know, the local fire department allocation, and looks fine to me. Looks legit. What I want to so I support this item, and I want to also, you know, take the time to address kind of a false equivalence. There's a fine difference between the fire department and the police department. And there's a public comment that somebody made that in the July 14th meeting about how, well, what if someone from the fire department is a bad apple and commits arson or something? And why is that, like, why should we not call for defunding the fire department instead of, you know, funding them? And that's because if someone commits arson, then, you know, they committed an illegal act, they get arrested for it, and there's accountability. And presumably the fire department would axe them from their job. That is not the case with, you know, the Monroe County Sheriff's Department. For example, with Sean Carr, I, you know, emailed you guys countless times. He should have had been charged with multiple DUIs and lost his job the first time from not sent to public, not sent to after crashing his vehicle. That's kind of stupid, but I don't want to digress too much from what this is relevant to. I support this item. This is why I support this item, and not necessarily an item that would, you know, give a blank check to the Sheriff's Department. Thanks. I yield my time.
Thank you, Mr. Goodlad. Are there any other public comments?
There do not appear to be any hands raised.
Thank you, TSD. Then now we can proceed with a vote. Could we have a roll call vote on this issue, please?
On the motion to approve Resolution 2020-37, council recommendation to the Monroe County Local Income Tax Council regarding public safety local income tax funding. Councilor Hawk?
Yes.
Councilor Deckard?
Yes.
Councilor Iverson?
Yes.
Councilor Wiltz?
Yes.
Councilor McKim?
Yes.
Councilor Munson?
Yes.
Councilor Spoonmore?
Yes.
Motion passed unanimous.
And I apologize, everybody. I've got a very intermittent internet signal right now. I'm just gonna turn it over to Kate so that we don't have any more disruptions here.
I think that's a fake background. I think you're really out on the lake right now, walking around.
Poor Eric. He's calling in from his vacation. So our next agenda item, I believe we are on number 6, which is an update from the auditor's office on revenue. And I believe we have Bree Gregory, our county financial director, here to give a brief summary of a report that she had forwarded to council regarding the current status of county revenues. Ms. Gregory?
Hi, everyone. Can you hear me?
Yes.
Good. Well, good evening. Thank you for having me. Tonight, I just would like to provide you with a brief overview of the revenue model you are now receiving monthly. This report comes to you at the request of Auditor Smith and is a tool she has wanted to provide you for some time. The report is designed to assist you with making informed decisions while reviewing budgets, additional appropriations, as well as just for the sake of transparency throughout the year. The monthly revenue report highlights 17 funds, including the general fund, and provides a clear picture of revenue received and cash balances at a glance. Are we able to, can I share my screen so I can pull this up, or let's see.
Yes, you should be able to.
Okay. Oops. Maybe anyway. Okay. Can you guys see that?
Yeah. Yes.
Okay. So, if we look at here, the county general fund right here, you'll see monthly revenue totals from 2017 through 2020. Then there's a 12-month moving total and monthly cash balances for the same period. In addition, there's percent increases from the prior period for each of the data fields if it's applicable. And I've also included graphs to assist with revenue comparison and provide a picture of how the current period compares with prior periods. Finally, there's also for each of these funds notable receipts from 2018 through present for comparison as well. Moving forward, Kim Schell and I plan to work together to provide the same type of report, same model, but for expenditures and additional appropriations as well. We hope to provide all 3 reports to you beginning in the next couple of months. And we can present this information to you if that is your preference. Otherwise, we'll just continue to send reports via email, so you'll have it for your work session meeting every month. With this new model that you have and with any reports we provide you, please just contact if you'd like to see any changes or additions or anything for added to it. This is a tool for you, and my goal is to ensure that it has all the information necessary to help you continue to expertly serve Monroe County. The privilege to assist you with making these financial decisions and providing you with Monroe County's financial metrics. Working together with you is a good example of financial best practices and financial transparency. On another topic, I also have a brief update on the county CARES and FEMA grants. As you know, the county has received over $4.7 million in the form of a reimbursable grant to help cover COVID-19 expenses, which is the CARES grant. That grant reimburses expenses at a rate of 100%. We also are able to submit claims through FEMA, which will reimburse at a rate of 75%. To date, we have collected about $716,000 worth of expenses we plan to submit for reimbursement in early August. This number does not include any personnel costs, which will be calculated and submitted as well. We will be utilizing both grants to ensure the financial burden to the county is minimal. If anyone has any questions, I'll be happy to try to tackle them. Otherwise, you're free to email me anytime, of course. I'm happy to help.
Thank you, Ms. Gregory. I know I really appreciate the reports and the way they're laid out. It's great. It looks like we already have a hand or two. So Jeff and then Peter, please.
Thank you very much, Ms. Gregory. This is fantastic. Really appreciate this format. But I guess since you had asked for anything else we'd like to see, the one other fund I wouldn't mind seeing is cable franchise fees. Okay. And in particular, this one, if you can break it out by provider, because I know the revenue comes in by provider and you can actually see that on the revenue lines. And I think that would be really useful to see. We know that it's going down and will continue to go down at some point to where it's really non-existent. But yeah, if we could see that by provider, that would be fantastic.
Absolutely, I'll include that in your report next month.
Thank you.
You're welcome.
Councilor Iverson.
Ms. Gregory, thank you so much for presenting this today. And we have communicated via email, and I really enjoy the trend lines. So thank you for the graphs. I think that it's really helpful to kind of put things into perspective. And so I really appreciate that. And one of the things that I would like to see is in the terms of financial transparency is I know it really helps me to see these, and I would like to see at least some portion of this and maybe have a conversation with County Council colleagues here on making sure that some of these data are available on our website as well, or a website of county government. It doesn't need to be the council's website per se, but smarter people than me might be able to glean important information out of this that would help us do our jobs better, or maybe even just find it interesting in terms of knowing how their tax dollars are being allocated or spent. And so these reports have really kind of generated a lot of thought, so I appreciate them.
Thank you. I will work with Kim, and she and I will discuss the best way to get this out to the public. Thank you.
Councilor Deckard.
Thank you. I've struggled with unmuting myself. Hopefully I'll be better with the budget. My question is, as the CARES revenue comes in, the FEMA revenue grants come back in, will that appear in this revenue report? Will we see that coming in with it and plotted on the chart as well?
That is not currently included. I could add we're keeping track of it on an Excel spreadsheet. So I could include that as an attachment with this. If that interests everyone, absolutely, not a problem.
Well, I will let other greater minds. I just keeping sight on that and not losing that in the shuffle. I know we've had a lot of expense that's come out certainly, and just being mindful of that as we're moving forward.
Absolutely.
Are there any other council comments or questions for Ms. Gregory? I know that I was going to make a comment similar to Councilor Iverson's about how we could maybe share this information with the public. So if our legal could make sure that there's absolutely no problem with getting that kind of put out there as well, I think involving Ms. Rice in the conversation maybe would be appropriate. I guess I'm asking, are there any reasons we couldn't, or parts of it that we would have to adapt before putting out there? I guess I'm not sure what the considerations are. And I'm asking for anybody who might have more information about this than I do. Nobody knows.
I don't think there's any privileged information included, but I can certainly get with the legal department while we discuss the best way to bring this forward if it's possible.
Yeah, I mean, I would certainly think all of this is, I can't imagine any of it would be privileged either. This is all certainly public information.
Yeah. Yeah.
Yeah. This is Margie Rice. I was finally unable to unmute myself. Yes, I think that all of the information that Brianne just shared could be shared publicly. I think it's information that was presented to you. Of course, you know, they are projections. There's no crystal ball and no guarantees, but I do think that all this information, you know, historically, it's totally appropriate to share. And if it, to the extent it represents any forecast, it's just that. It's just kind of a projection. So it's totally fine from my perspective.
Great.
And are we distributing this report to anyone else outside of council right now in the auditor's office, or is this something that we might want to get out to other departments and offices as well too?
I've also been sharing this report with the commissioners, and of course, anyone that has interest, I'm happy to share with whomever within the county.
Great. So if there's any departments or other elected officials listening and would like to have access to this, very easy, just contact Ms. Gregory and we'll get you on the distribution for that.
Thanks, everybody. If there are no more questions or comments, we'll go to the next agenda item, which I believe is a 2021 council budget update from our very own Ms. Shell. We're going to review our council departmental budget, as all of the departments are preparing their budgets for 2021 right now. Our office is no different. So our budget director, Kim, will go over the changes to our 2021 budget.
Hi, council.
Hi.
So just for a moment, we have a budget web page. And so I'm thinking, and I'll get with Bree, and I'm thinking we can post that information to the budget web page. And then as her and I develop the monthly expenditure reports as well as the monthly additional reports, that is basically the only place I could think of right at this moment that we could house that information for the public. So, and then we can have links from the different departments, or from like the council page or the auditor's page to that budget page. So, but I'll get with Bree and we'll work on that. So,
cool.
Okay, so with regards to the budget, I sent that out to you guys, and there are a few changes that we want to look at for 2021. And one of them is the request for the part-time hourly. Currently, the auditor's office has a part-time person that is doing the verbatim minutes for the council office. And she's also doing the summary minutes for the council office. But beginning January 1, Megan, the council assistant, will begin doing the summary portion of the minutes for the auditor's office. That will be her responsibility, and that's in her job description to take care of that. So since the verbatim minutes are not a required for DLGF or the State Board of Accounts when we're uploading documents, this is more of a request that this item be paid for then by council, that this part-time person then be moved and paid for out of the council budget beginning in 2021. So if you want to talk about that one right at the moment, and then we can move on.
Does anyone have any questions about the part-time hourly line on our budget for next year?
Yeah.
Mr. McKim.
Yeah, I certainly don't have any problem with this. I'm assuming that we'll then see a corresponding decrease in the appropriate line from the auditor's office. I mean, I don't know if anybody's on the call or on this meeting that can actually answer that. I just kind of wanted to throw that out there, and something we'll want to make sure that this really is a transfer, not a net increase.
I can't answer that.
Yeah, no, I know. I didn't
Yeah.
figure it.
Well,
I just wanted to get it out there.
That was my understanding of how it would
assumption
work as well. I think also something that we'll need to think about is, our training budgets and what that's going to look like as well too, and how much more we want to take on, and where can we find opportunities for coming up with dollars to support training that I think is very much needed across county government. So just something for us to think about.
So I was going to say, currently the part-time person is doing 28 hours a week, and that's because she's doing both the verbatim as well as the summary minutes. And since Megan will be taking over the summary minutes portion, we don't have to, go the whole 28 hours. So, I mean, that is a number that is flexible for you guys. She is currently working from home and is able to do this and continue this from home as well. So.
I see a question from Councillor Hawk.
Yes, so she's just keeping track of how many hours, and then that's what she's turning in, not that she's guaranteed 28 hours. Or
correct.
Is that correct? But if we ever get back to the old normal, and we actually have staff and my dog's crying, in there, she would be then the county council staff and not the auditor staff. So she would, in that spot where she was sitting before, that's where she would be located. Because
yes.
I can't figure out where each of you people are going to be located inside the council office. So, but what I was thinking, that since she's very familiar with county council, since she used to be our council assistant, that if during the time that you're building up some comp time during all budget sessions and whatever, how that happens every year, that at least there would be somebody there in the office to cover it if we ever get back to where we're trying to keep people in that office for the public to come in. I don't know how long that's going to be before that we get to do that. But, right. I mean, she's an excellent worker.
Yep. Agreed with all of that.
Kim, do you have an idea of how many of those 28 hours she's spending or would be spending on doing the verbatim minutes?
No, but I can ask her how it's working out currently.
And we're looking at about $25,000 a year.
And that's if we go having her go down to 25 hours a week instead of 28.
Right. I think that's a lot of money for minutes when we have recordings of the meetings and we already have summary minutes. And if we need money for other things in our budget, like training, as suggested, I would be willing to entertain maybe not having verbatim minutes. I know that that has been discussed in the past and we keep settling on having them. I, for one, have never accessed them. That's not true. Once we did access them shortly after I started, so in a year and a half, but we could have found the recordings, the CATS recordings, and used those. And used the summary minutes to locate which parts of which meetings we needed to find on CATS. Does anyone else feel this way, or am I just way off base?
I think it's a very valid, legitimate suggestion. We may need some more time to mull it over and, think about the various implications. But I think it's very worthwhile to be considering.
I kind of feel like we've had this argument a couple of times.
Yeah, we have.
But one of the things that keeps getting suggested that we probably really ought to try is using the I think YouTube transcripts. That apparently are automatically or can be automatically generated. There's some limitations. I think the meetings can't be longer than 3 hours, or it has to be broken up into 2 or something like that if they're longer. And I don't swear that 3 hours is that number, but it's something like that. There's a hard limit. But it's certainly clearly the technology is only going to be getting better in terms of transcripts. So I certainly think we ought to try that. I think it's just going to take some focus on working with I don't know whether it's CATS or tech services, or working on the workflow so that it gets uploaded to YouTube and generates a transcript and so on. I would have done a little more research if I had known this was going to be an issue, but I know that we have talked about this before and it's come up.
I do know that we tried to do a transcript from a CATS, and it comes in, there's no punctuation, it doesn't tell you who it is. So the problem is you would be doing a lot of editing as well from the CATS or the transcript, from the YouTube transcript. Eric Evans was able to pull one off for us one time, and we spent just as much time editing it and getting it into a form as you would have if having our part-time person type him out. I think she's a lot faster with regards to that. I do know that with regards to remodeling the NatU Hill room, that the TSD had asked us if we wanted to have a program or a system or something that would do this for us. And so I believe, my understanding was he was going to look into that when they started working on remodeling the NatU Hill room, so that they would find a system that would automatically do a transcription as well.
Well, I think if it can be rolled into the remodel, I think that's fantastic. I think part of the problem that YouTube has is the poor sound quality in the existing room.
It was, because it would only pick up certain voices that it could hear, that kind of thing. So,
but I would also say that with a YouTube transcript, with all of its inaccuracies, do we really need to correct that? If we have that and we wait, we still would be going back. If we ever needed it, we would go back to the video and just put that off until we need it. I don't know. I mean, like I said, I'm less enchanted with the verbatim minutes concept, I think, than some others, but I think we should consider the cost benefit on.
And we have no problem being able to, if somebody wants a certain portion transcribed, I think that could be done between Megan or myself. You know, if you want just a specific portion typed verbatim, you know, regarding a subject or an item on an agenda, rather than the entire meeting, because that can be done just as quickly.
Mm-hmm. Councilor Deckard.
Thank you very much. I understand exactly sort of where the different thoughts are on this, and I myself go back and forth. When I first came on council, I sort of lamented the time that we spent talking about minutes. It seems like we were talking about minutes a lot, and obviously in the community there's a lot of issues out there beyond minutes. I will say this: I think we've heard from the public an interest when they have interest to know more about certain issues, more about things that happen, more on public record. And as we would move forward with options, I think we have to think about what's the most efficient, what is ultimately the most accurate, but what also really preserves the ability for the public to come in and know this is what they did in that meeting. Here were the sentiments that were expressed. Here were the thoughts of council members as they tried to figure it out. I think even probably department heads at times have to go back and consult things to try to figure it out. You know, we're not always as clear as the mud that sometimes comes out of our mouths, and I'm one of the most guilty of that. So I think this is tough. I do agree with Councilor President Spoonmore on training dollars and figuring that out as we move forward. I know the Beacon had some recommendations on the transcribing portion. Maybe the sound quality does assist with that quite a bit. I do think that, though, there's a portion that the public is going to want to preserve, to look at, go back to, and ask those tough questions on what we've said and what we meant and all those.
Anyone else have other thoughts? Thank you, Trent. Michelle, do you have other parts? Oh, I'm sorry, Councilor Munson. You're muted.
Not on minutes.
Okay.
About other parts.
Okay.
The next thing I have, I did an increase in contractual for 2021, and last year or for this year, I should say, this year we had 13,000 in a contractual, and I increased that to 25 with regards to not really knowing what we're going to do with regards to the job descriptions, salary grid reviews that we're thinking about, kind of thing. I know that it's a low number, but it gives us something to start with. So that's the reason for the increase in that line. I also increased the travel training line. For this year, we budgeted $345. I think that was a typo that I didn't discover until just this year. And that's because the first quarter of this year, we spent over $1,100 in training. And that was just in the first quarter with regards to a conference that everyone attended. And so, so with that, with the conference and the mileage that was included in that, I upped it to 1,700, and that would take care of the 7 council members. And this I'm just guessing. 7 council members, Margie, myself, and Megan. So.
And that was the AIC Legislative Conference?
Yes, it was. And then the next increase is for the community service, the Sophia Travis. We went with the maximum levy growth quotient percentage, which is 4.2, and increased it to $5,000 for a total of $135,000 for 2021. So is there any questions with regards to any of those items?
Councillor Munson and then Councillor Spoonmore.
So I would like to comment on the Sophia Travis grants funding by relaying what the city of Bloomington is doing. They approved this year with their very similar Jack Hopkins Social Service Fund, $318,000 compared to our $130,000. And the budget proposal coming to the City Council for Jack Hopkins next year is an additional $200,000. Knowing that there are going to be many challenges next year, carrying over from this year. And I don't know if we will be able to stay with the growth quotient as the most reasonable reference for increasing funding. And I just throw that out for everybody to think about, for the public to know that our increase is very, very small compared to the cities. And I know we will need more.
Councillor Spoonmore, did you still have a comment?
Yeah. So, and thanks to Ms. Shell for all this great information related to our budget. I think the contractual increase makes sense. We know those costs are going to be coming. There's a lot of work to do there with that initiative, and we know we're going to need resources for it. So I think that looked like a reasonable estimate for what we can expect. And we'll just continue to play things by ear with that as we get a better understanding of how those costs will shape up as we work with our partners at WIS, which I think is going to be the majority of that. And then with Sophia Travis, so that the way that we came up or that increase was formulated has been based on previous years, right? We've done that for, I just can't recall off the top of my head, but that's basically how we've done it in years past, right?
Yes.
Okay. Okay, great. Thank you.
Councillor Hawk and then Councillor McKim.
Yes, I just wanted to remind the public, if anybody's listening, that the amount that goes to what was the former VAM clinic is what, 200,000, is that correct? Is that what it was? So
250.
What, how much?
250,000.
250,000. So and that's actually a part of the social service. So if you added that 250 onto the 135, because really, I don't know why it's not all in there together anyway. It should be, instead of having it split up like that. But that's something we have to recognize, because it doesn't matter which pot is coming, whether it's out of the commissioner's budget or the council budget, it's still, all of it is in the social service. So we wouldn't want anybody to think we aren't doing a whole lot more than the 135.
Mm-hmm.
Thanks, Marty.
Councillor McKim.
Yeah, 100% agree with Marty on that. I don't necessarily agree that they should be thrown into the mix with Sophia Travis, but I definitely think if you're comparing like with like, that $200,000, $250,000 definitely has to be included in the calculus. So thanks for bringing that up. And I'm not proposing changing it here for the submission, but we just heard from the commissioners discussion about potential anti-racism and bias training for all county employees, including elected officials. I know there was some discussion about having that come out of each department's training budget. I don't know if that's where it'll wind up. So by the time we actually get to budget work sessions, we may want to reconsider that training number, but I'm not proposing changing it for the initial submission. I think what you've got there is right. I was curious when I saw the $345. I was thinking that covers maybe one person to go to one Indianapolis conference for one day. So
it's the same amount as dues that, you know, it's a couple lines ahead. So I'm just assuming that it was just a typo, because if you look prior, it was to the expended in 2019, it was over $1,200. So it was just a typo.
Yeah, no, that conference is so valuable, I think, to all of us. I mean, hopefully we'll get to a position where we're traveling again and meeting face to face. But yeah, those AIC legislative conferences are worth their weight.
Yes.
Now that we're talking about the training and conferencing, that the excellent information that we received, what was it, Jeff? Was that 2 weeks ago now? That was wonderful. I hope every one of you have had an opportunity to watch that. If you haven't, I highly encourage you to do it. It's essential that every member of our council watches that, because it is available. I know you watched it, did you not, Kim? I thought you were online with us.
Which one was it?
Greg Garatos in the morning.
Fred Van Dorp.
Yeah. And then in the afternoon, it was DLGF, Fred Van Dorp. It was essential for each of us to hear that and understand what they're proposing and how we should understand where our revenue and so forth. So,
that's a good point. We should make sure that link gets sent out, because that was
right. And really, it would be great if that link, could that be available on our website too, or is that like not allowed, or how can we do that?
That I don't know, since that is generated from AIC. So I think it was AIC, wasn't it?
No, it was the state.
DLGF.
Was it DLGF? Okay.
I think so.
Because it was that required, it was supposed to be required. Remember it was what we normally have every year for required training. So, and we normally have to leave. I really liked it better this way.
Yeah, I know that the DLGF has links to all of their webinars that they've been doing, so I can get that and put that their webpage link on there.
That might,
it's worth your time. It's worth your time. I encourage you to do it.
I would second that. The webinars, the DLGF webinars are fantastic, and they're the speed that like everyone can watch and learn. They're really good.
Greg Garatos was the one that was coming out saying, you know, even though they're saying 90%, and yes, that's, you know, but he was saying, look, you cannot wait until you make certain adjustments until that 1782 comes back, because it's too late. You've already done your reporting. And he made it very clear, we need more than one set of eyes looking at the numbers, because it's just like when you're writing a grant, you need somebody else to look at what your grant proposal is. So put together. So I encourage you all to look at that and then get back and see if there's conversation we need to be having amongst ourselves to prepare.
It actually was sponsored by AIC. I just found the link. I forwarded it to you, Kim, so you can send that out. But yeah, one of the speakers was I guess, I can't remember what his title is, but the high up director of finance or something. Fred Van Dorp.
I was thinking it was originally AIC and that Fred Van Dorp was like assisting or something. So
he was one of the presenters.
Right. And Greg Garatos did a great job too.
Was the other one. Yeah, they were excellent.
We can have a watch party.
Yeah.
Hey, I already had a watch party. Jeff and I watched it.
I couldn't join on a weekday. That just didn't work out for me, but I'll definitely check it out. Anything else on the budget, Kim, for us?
No, the deadline for departments to submit their budgets is Friday. I do believe that we have a couple departments that need to meet with their boards or, kind of thing. So they'll be a little late, but we should have the bulk of them in this week. So, and then Megan and I are working on getting that information into our major spreadsheet so that we can get that information into Lao, so we can get that out to you guys ahead of time. So.
Great.
It's a huge undertaking. Thank you very much. It's really appreciated. Councilor Hawk.
Yes, when you get that ready for us to see, will it also be available that the public could see what is being projected, even though it's a draft and we're not anywhere near close to getting it together?
Yeah.
In this whole idea of trying to make sure the public knows in advance so they can have an opportunity to contact any of us. It's kind of too late to give it to them after we've already decided what we're going to do. So I don't know whether, at one time I had asked for that, but it was going to be too much to go on.
Yeah.
It took up too much whatever bandwidth or whatever you call
Yeah.
it.
Jeff McKim and I talked about that. So Jeff, if you want to go ahead.
Yeah, thanks. I actually did know it's a great point. And actually, yeah, Kim and I talked about it a little bit earlier. I think we always talk about the budget process from the council's perspective, like what we have to do when. But I think you can also then look at it from from the public's perspective, like when can the public see what's in the proposed budget and when they can make comments. And so, if just bear with me for a second, I just kind of want to talk through. I think this is something we should put in writing on our website to make it more explicit, but I kind of want to talk through and hear everybody's thoughts on this. So we just heard that the department's budget submissions are pretty much due this Friday, although some might not make it because they've got boards and commissions that have to meet and approve their budgets. And in the past, like Marty mentioned, we haven't made these budget documents particularly publicly accessible at this stage, just because they tend to be a fairly large and complex spreadsheet. But we were thinking, Kim and I were thinking that as soon as she gets it all the information collated, corrected, entered into the spreadsheet, she could make it available on the county website in the form of a PDF document for public access and public inspection. And that way, just like Marty said, that anybody could log in, see the departmental budget submissions in full with all the detail, each detailed line, so that they can then start to make comments to their county counselors. So once it's online, I think the idea is that Kim thought that probably a preliminary version could be available by the middle of the month. That'd be in the middle of August, with a complete and final and corrected version by the end of August on the website for members of the public to be reading, digesting, and making comments to counselors. Then we have the budget work sessions from September 8th through 11th. And of course, we'll be then discussing and making modifications to those proposed budgets at that time. After that, the information gets entered into the Gateway system, the state's transparency portal. And Kim, I know we talked about this, but I forgot. What's your target date for Gateway entry?
Let's see. Hang on. Looking at a calendar. It will be the 18th, September 18th. It will have to go into Gateway to be published in order for us to meet our deadlines of public hearing as well as adoption.
Okay, so on or before September 18th.
Correct.
It goes into Gateway. So once Kim hits the button, that's the kind of formal publication of the proposed budget. And so that's when the public's kind of official notice period begins. Although, as we've just discussed, we can kind of we're creating another comment period beforehand. But so the budget gets published on the 18th through Gateway. Then it's available in a standardized format. The public can again review and communicate with council members about that budget. And then on September 29th, we hold our formal public hearing for the budget. And then that's where the public has the ability to share their thoughts with the county council on camera. And then they'll still, even after the public hearing, can still share their thoughts with council members in writing or in phone calls or however, but all the way up to the budget adoption. And so that leads us up to budget adoption. And then we're scheduled to do the first reading of the budget on October 13th, and the second and the final reading of the budget on October 14th. During both of those meetings, a formal on-camera public comment will be taken as well. So does that kind of cover the gamut of public comment, essentially starting from departmental submission all the way through final approval? And I was thinking if we all kind of agree with that, we can create on the webpage, we can kind of narrate this on the webpage that makes it a little more clear with links to where the public can actually get this information and what they can do, how they comment during these periods of time. Does that make sense?
Be great.
I really like that idea. That gives folks 2 months to digest the information. I like
and we
that
just
a lot.
have to make it, and we just have to say it this way, like on the website, here's how you make public comment about the budget. And because, we get so used to what these different dates are, what's the public hearing, what's budget adoption, and nobody who's not really engaged in that world knows what it is. So I just think we need to make it explicit.
Yeah, this is a really good idea. And I think it'd be fairly easy to implement as well too. We should be able to whip that up pretty quickly, I would think. But anything that we can do to encourage more public participation and engagement in this process is going to be really important. And I think this does just that. So I'm fully supportive of this type of plan. And it is right, as Mr. McKim just said, there's a lot of inside I think we have a very transparent process the way it is. It's set up that way, but you have to know all the inside baseball to understand it. And so the more that we can outline all of this and really, delineate the timeframes and everything, I think will be really, really helpful.
Right.
So great suggestion. Thank you, Mr. McKim.
Well, and thanks for Councilor Hawk for bringing that up too. So
yeah.
So if there is someone willing to draft the kind of narrative for the web page, I would be happy to kind of do the second look, edit, review if somebody is in need of that. I'm just saying I'm willing to participate, but I'm probably not the best first draft person.
I'm happy to take the first cut at it.
Thank you.
Great.
That's cool. All right. Very cool. I'm excited about that. That'll be really good.
And then once you guys just, get the draft and figure it out, then it will take Megan and I just a little bit and we can get it up there.
And something we may want to send to media too, just so they have it. Well too.
Yep, we can do that.
Okay. Sounds
Awesome.
great.
Thanks.
Any other budget comments, questions, thoughts? Yes, Councilor Hawk.
Just think we have to make it very clear when we're presenting it, that this is what the different departments have requested. But then it will be up to the council to figure out how to pare that down to what dollar amount it is that we actually have to spend. So how many times we looked at it and gone, well, we have several $100,000 we're going to have to reduce. We don't know what that's going to be this time because we don't have the budgets presented to us yet. So we would just need to make it very clear to the public, this is just in draft form before we've really, made this. Then we have to make the sausage.
Yeah.
If I could add to that, I appreciate very much the language. This is what departments are requesting, but this is extremely, very much a work in progress. And anyone that's watched the county in action knows that there is not one person with the entire answer for everything. This is extremely collaborative, very different than many other forms of government, branches, et cetera. It's very collaborative, and work in progress really does justice for what this 2-month period is.
It's unusual. It's different. I thought this was what everybody did. All right.
No, we're special.
I like it. Anything else? I was busy scribbling notes because I liked Marty's wording as well. So I was trying to get that in there. If we are finished with our own budget and we're good with Kim moving forward on that, consensus, nods. All right, cool. Kim, any questions for us? You're good?
I wanted to make sure that you guys know that to be thinking about a COLA, a raise, whatever you want to call it, with regards to, we want to make sure that we advertise high enough. If you guys decide to do that, and I think we need to have a discussion. We don't have to have it like tonight. But we definitely need to have something in mind before we publish to Gateway. Because once we publish it to Gateway, that's our limit. We can always go lower, but we can't go any higher. And if there's an error or a mistake that we find, and hopefully with all this, everybody seeing it, ahead of time, we'll be able to get that in there, but we need to make sure that what we've got is going to be enough. So that's my only thing, is we need to figure out what we're going to try and do, if anything at all. So,
Councilor Hawk.
And right, and following along with that, I think it's essential that you all listen to that presentation that we were talking about, because that helps us determine we really don't have that 4.2% growth if you start at looking at what your circuit breaker might be or whatever, because you have to take that, you have to take a look at all of your revenue, and then how much that we might project, and then what kind of other losses will come off of there. So it's important that we all understand that, because Greg Garatos, I thought, made a great presentation for that. Did you agree, Council Member McKim?
Absolutely, yes.
Councilor Munson, did you have something?
Yes, I thought in previous years that we came up with a cost of living adjustment and sent that to the department to include in their budgets. Is my memory wrong on that?
No, I believe